And adults, what about your dental health? Do you know what quantifies as a dental emergency? Well, you might have symptoms that you're not aware about. JH Emergency Dental can help.
Good morning, Dr. Samuel Escarcega with JH Emergency Dental. I'm really looking forward to clarifying here for a lot of our audience the difference between emergency dental services and something that could probably wait. How are you?
Good morning, Roma. I'm doing well. Thank you for having me on here, and I'm happy to talk about JH Emergency and answer all the questions that you may have and also the viewers and San Antonians may have.
Let's clarify, what does qualify as an emergency procedure?
Good question. Folks call me for various reasons. Usually it's pain oriented. They've either broken a tooth, they were eating something, or they woke up and they have a swelling. Something along those lines is generally what we get calls for. But I've also had patients that has missing a tooth and it's been bothering them, and they finally decided to make a call and get seen, and they want a solution for it. So pretty much emergencies outside of the obvious pain and infection can really be whatever the patient deems an emergency.
You had a friend who had to go to the hospital because he dismissed a pain, right?
Absolutely. Yes, I have a good friend, high school friend. We've been friends for over 30 years. And a few weeks ago, we were having a conversation, and he had told me that he was having some pain. He was just kind of describing to me some vague symptoms that seemed to be more of like a cheek biting incident. 3 days later, he ended up with a huge facial swelling that required him to go to the hospital. He ended up having 2 teeth extracted. He had to have multiple drains placed in, which could really turn into a life and death situation. He was hospitalized for about a week and a half, and just now is starting to feel better. Had he seen a dentist or seen someone like me sooner, we would have been able to keep him from going to the hospital and having to have those multiple drains and losing a week of his life, and then potentially risking his life. We could have prevented all of that by just coming in and having me look at it. So yeah, I encourage all the viewers, if you have pain, toothache, don't ignore it. We're here for you. We'd love to see you and take care of you.
What are some tips for people to avoid having to have emergency services?
The tried and true standard: brush and floss your teeth, see your dentist regularly for cleanings and exam and x-rays. That's the best way to see things that are developing and treat them in a way that will prevent really bad things from happening. Other than that, trauma, if you're somewhere and you get knocked in the face and you have a tooth that's broken or you bite down on something really hard, those things you really can't plan for, but that's where I come in, and that's what I'm here to help folks. So broken teeth, pain, infection, give us a call. jhemergencydental.com, or they can call us at 210-910-4377.
Perfect. Thank you so much for all this really useful information and for clarifying some things there for us. Take care, doctor.
I appreciate it. Thank you, Roma.
I said it there and I'll say it again. That was so helpful. And if you have an emergency, you can go to 1485 Nacogdoches Road, suite number 5. Call today and you'll get seen today. 210-940-2370. Make sure you visit their website on your screen as well.